Let's talk about the transmission of this virus. After COVID, people are understandably nervous about things spreading and how quickly viruses can mutate. What can you tell us right now about monkeypox?
So what we know about monkeypox is that it is spread generally by direct contact, and it really has not been an issue of transmission outside of areas where it's endemic in West Africa. So imported cases have arrived in various countries around the world, as you might expect these days, but there's not been ongoing transmission except to household contacts, and in one situation to a healthcare worker when someone was in the hospital. So it really does, in general, require very close contact for transmission. And it's because of that that people are thinking that this is something that can be contained. The problem that we've seen is that a case of monkeypox has a very long differential diagnosis. It can be many other things. And so if you just see a case of somebody with a rash in, say, Toronto or Boston, you don't think monkeypox immediately. And so many of the early cases in this outbreak were missed, and that's allowed it to spread further. And so it's going to take some time and energy to get control of it. But as the World Health Organization told us this morning, it really does require very close contact for transmission. And so it's very unlikely that it's going to spread very far before we can contain it. We also have vaccines that we can use.
Yeah, that was going to be my next question.
That likely work. So, yeah.
Yeah, so the former head of the WHO emergency department, Dr. David Heyman, said that two raves, one in Spain and one in Belgium, may have been two areas where it led to widespread an outbreak beyond Africa. So when we talk about a vaccine, and again, people are very nervous after COVID, who should be thinking about getting that smallpox vaccine for protection?
So the way we'll likely use it is exactly the way we used it to contain smallpox outbreaks in the time when we didn't have endemic smallpox in much of the developed world, but there were still smallpox in other parts of the world. And that's a strategy called ring vaccination, which means that when you identify somebody with the infection, you vaccinate all of the contacts, or you offer vaccine to all of the contacts and all of the contacts of the contacts. And that way you make sure that it doesn't spread out of that ring, if you would like. So this is not a situation in which any of us should be lining up to get vaccine. It's a situation where public health will identify potential contacts and talk to them about vaccine. We're also I think not sure how much vaccine there is. The vaccine that we have that's available is actually intended for smallpox. But smallpox and monkeypox, as you might guess from their names, are related to each other, although monkeypox is much less severe. And the smallpox vaccine appears to work for monkeypox. So there's another question about how much vaccine is available, how quickly it can be made available to people. So we're not going to use it broadly at all. We're likely going to use it to contain rings of disease.
Doctor, what's the likelihood that this virus mutates?
Well, all viruses mutate slowly, but what we've heard so far about the sequence of this virus is that it looks very similar to other recent viruses from the western part of Africa. There's a range of variation in viruses throughout Africa, and these look more like the ones from Western Africa, but they do not look as if it has any mutations that would make it more transmissible or more virulent or different in any way from the monkeypox that we've had around for years.
Dr. Allison McGeer, thank you so much. Dr. McGeer is an infectious disease physician with the Sinai Health System. Appreciate your time.